Welcome back, and thanks for staying with us. We continue our look at women making a difference, and our next guests are making an impact in civil society. Section 27 is a renowned civic organization that says it's a catalyst for social justice. Umunyana Rugege is the executive director of Section 27, and Nontsikelelo Mpulo, who heads the communications. The two ladies insist they'd rather talk about their work to show the important impact that they're making, and let's welcome them into the studio now. Ladies, thank you so much for making the time this morning.
Thank you.
All right, talking about the work that you do, and we will talk about ladies' stuff later. In a bit, I think at the 2nd of September, the Michael Komape case is coming up. If we want to remind our viewers, Michael Komape was a 5-year-old who fell into a pit latrine at Mahlomadumela Primary in Limpopo, and it brought up that conversation about pit latrines, and the case is coming up again on the 2nd of September at the Supreme Court in terms of the parents wanting to make a claim. What is Section 27's role here?
So our role is as legal representatives. So we represent the Komape family, and we have done since 2014 when Michael died. We represented them at the High Court, and we're now going on appeal to the Supreme Court of Appeal. So what we want really is to ensure justice for the Komape family, for the parents of Michael who died so tragically and in such horrific circumstances, really stripped the dignity of the child and of the family. The mother actually discovered his body inside the pit latrine, and you'll remember the image.
I remember that story all too well.
Yeah, and the image of Michael's little hand sticking out of a pit latrine, having died there, suffocating from human excrement. And it really did, create this national dialogue about the safety of schools in rural areas, but all schools really. Yeah. And we saw that the government has now come to the party. The president has a new initiative.
That's SAFE
the SAFE
project.
initiative.
Yeah.
And we are all talking about sanitation, improving sanitation so that we never see another child harmed at school in this way.
So it goes beyond justice. It has created activists out of Michael Komape's parents who are working with you on this case. Absolutely. But how far has that SAFE, the Sanitation Appropriate for Education initiative, how far has it gone?
So they're busy, that you have to do an audit. Really, the data has to be relevant to the whole project. So you have to know how many schools there are, firstly, how many schools are in need of upgrades, how many schools don't have any sanitation whatsoever, how many schools only have pit latrines. So it really is very important that that information is reviewed by government and by others. So we also did our collection of data in Limpopo, and we created a report in which we went to every single school and showed the level of sanitation facilities available at that school. So we have to work together on this.
Is there an improvement though?
There is no improvement, and there are plans in place, especially in the Limpopo provincial government, to improve the school sanitation, but they're taking too long. And part of what we are saying is that there must be greater urgency, because we've seen other children being injured and in very similar circumstances.
That is totally shocking. When you remember the grandness of that launch of the SAFE project together with education, Nontsikelelo, why is there no movement? Are you interacting with the presidency?
We, at the time that he made the announcement around the SAFE initiative, congratulated him and were very excited about it.
Because you thought he was responsive.
We thought he was responsive. But at that point, what has now happened is that he's asked companies to contribute to the SAFE initiative.
It was a public-private partnership.
Exactly.
Yeah.
And we have yet to see the actual delivery on the ground. What our report is around the schools that we represent in Limpopo. And what we found is that some of them weren't even on the list that the government had put forward. And so the information that informed the SAFE initiative was deficient. And so what we are hoping to do with our sanitation campaign post the SCA is to go back to the presidency and say to them, now we want to see delivery, because what they are saying in their plans is that they will eradicate toilets by 2026. that is unacceptable. It has to happen now.
What are your expectations in terms of the outcomes of the Supreme Court ruling that's coming up in September? Are you hoping to be victorious? How's the family feeling? Are they still up to this fight?
The family is certainly up to the fight, as are we as the lawyers. And we have put our case before the Supreme Court. We will be making oral arguments in the court on the 2nd of September. And we will be asking that court to relook at the High Court's judgment. What we would like to see is a declaratory order, which the High Court failed to give us, which was to say that there have been rights violations here. And I think it's important for us, as we, in our democracy, we have to keep unpacking the Constitution and make it real. So we need to understand that having a child die in those circumstances is actually a violation of rights in the Constitution. So apart from that, we are also looking for particular compensation for the family. We would like to see this court consider constitutional damages, which is a special form of damages contained in the Constitution that is all about rights violations. So we decided as a country that there will be a remedy for somebody whose rights are violated.
Yeah, so
and
you're saying
so
rights
egregiously.
without remedies are meaningless.
Yes, exactly.
Yeah.
So we're hoping that the SCA will make a ruling on that.
So we'll be watching to see how that progresses. But another project that you have is the talking book that you want to talk about. Has it been launched yet, Ntsiki?
We're actually taking it to Umunyana this weekend.
All right.
We have been working in the Umunyana district since about 2014. We were brought in on a case to get access to education for children with disabilities. There were about 100 children that were looking to get into schools. We were able to secure space for them, for 17 of them. And the reasoning behind that was that a lot of them had already been too old to enter school.
Okay.
And that prompted us to do work in the area about not only access to education, but what happens inside the schools. And so this is why we developed this book. The book talks to parents about how to access school and what happens what to demand when the children are in school. Because we found that there aren't enough teachers sometimes, there aren't enough house mothers, and so we're looking at post-provisioning in those schools, for special schools, but also we want to talk about full service schools, that these children have to be able to
need for
enter
that in South Africa.
This kind of space,
So what are the kind of conversations that are in the book?
So basically, some parents don't even know what kind of disability their children have. And so we outline the kinds of disabilities, and then also what to do if your child has a disability. You have to have them checked out by an OT or a doctor to kind of help you understand what kind of school that they need to enter.
There's usually a cost issue, though, related to that. And an access issue.
It's an access issue, but in public hospitals, you are absolutely able to access those kinds of services. In Manguzi, and the reason why we went to this is because we were invited by OTs in that area who were concerned about the lack of access to education for children.
Umunyana, your work is in the social justice space, and we speak about that so much. In fact, this weekend at the Stellenbosch University, I don't know if you're involved, there's a social justice conversation, a global one. What is social justice?
Well, I think for us, social justice is what is the promise that's contained in the Constitution. So what the Constitution talks about, it's about addressing the injustices of the past. We come from a fractured society, and what we want is to have greater equality, to have a country that's based on a democracy where people participate in different levels of democracy, whether it's local or national, to have a government that's responsive to the people, and to ensure freedoms along the lines of the Bill of Rights. So it's about making those things real for people. I think social justice has to be about ensuring a more equitable health system. We have a system in the healthcare sector that really reflects the inequality in the country. And as you know, South Africa is still the most unequal society in the world, and we have to begin to address those things. And that's what that's the promise of the Constitution, and it is the democratic project that we're all involved in. So I would say that's what we believe in, and we use the law, we use advocacy. Sometimes we're in court, sometimes we're in Parliament making submissions, sometimes we're protesting, and so we use all of those different tools to try and achieve greater substantive equality.
I like what we were saying earlier in the conversation about Michael Komape, where we were saying rights without remedies mean nothing.
Yes.
A person listening right now and saying, you know, these things are such higher grade conversations, how does it translate to me on the ground?
I think, you know, it's about being involved in structures, you know, in your communities. It's about getting to know the community healthcare workers, you know, finding out whether there's a library and working on a library for the community. It's about belonging to the SGB at your child's school. Or a school in your community, so that you're engaging in these democratic processes. It's not just about voting every 5 years or in local government elections. It's about participating actively as a citizen.
Ntsiki, how do we work on encouraging our citizens to be involved?
Well, actually, many of our citizens are completely engaged. I mean, when we are in the field talking to community health workers, they tell us about how they are getting information from the ground because people are concerned that the system is not working for them. You'll see that people are protesting because of the fact that their service delivery is not happening. What we need to be doing is to channel our anger and our frustration into positive action. So, I mean, in the example of the health system, there are complaints procedures through clinics and at hospitals.
Yeah.
And those are the
It can be frustrating at times, though. But ladies, we need to wrap up our conversations. Let's just talk about the work of Section 27 in relation to the recognition of gender equality, and one after the other.
Sure. So I think for us, gender equality is very important. From an organizational perspective, we have a completely female EXCO. So the leadership of Section 27 is female. We're very diverse.
Where was I when you were choosing?
We are a very diverse group, even though we're all women. And I think that's an important thing to, it's part of this kind of democratic experiment to see women leading in different spaces. And that's quite important for us. And also internally, we make sure that we don't have any gender pay gaps. We make sure that people are compensated equally. And we have a sexual harassment policy. We take very seriously the safety of our people in our office.
The ANC does not have a sexual harassment policy.
I think it's incredibly important. So organizationally, we're thinking about creating safe spaces. We know we live in a very violent society, and we think that if you have pockets where there's safety and you have people working and living in spaces where there is no violence against women, we'll start to see that filtering out in different spaces. But we do work on sexual violence. For example, we spend a lot of time in schools talking to young girls and boys about things like consent, and having great debates about what that means.
Quickly, Ntsiki.
And also partnerships that we make with people in the sector. We're part of a collective that works on gender-based violence, eradicating it and advocating and also creating policies. And so we actively want to promote the infiltration of women into all as echelons of society.
Thanks so much for coming through, ladies. Umunyana Rugege is the Executive Director at Section 27, and Nontsikelelo Mpulo is the Communications Head there.